The first time I met Mr. Mitchell was about 4 months ago. We got a referral for Mr. Mitchell to get nursing and social work. But when the nurse went out to admit Mr. Mitchell, his caregiver, his landlord, said that they didn't need social work, that he was just fine. That was a big red flag. And wouldn't let Mr. Mitchell talk for himself. He did all the talking for Mr. Mitchell. On a Friday night, his nurse, Kel, got a text from him saying, "I have to get out of here." And she immediately texted me Friday night and said, "This is the patient that we were a little concerned about, and he's now saying that he's got to get out of there, and I don't know what's going on." I called him and I said, "I'm coming out to see you," and he said that was fine.
I was living in a trailer with 10 people and at least 4 to 6 dogs. My mother passed away in 2018, and my brother passed away in 2014. And those were my only family that I had, and I was alone. I had trouble walking, trouble standing, trouble seeing, and I felt that I had no other options. I thought I would be forever stuck there.
So I remember the day that Geraldine came in to me and started talking to me about Mr. Mitchell. She had made a visit out to this individual's home that day and was explaining to me the deplorable living conditions that she found him in. No furniture whatsoever in his bedroom. He didn't have a bed to sleep on. He was living with individuals that took him in, but these individuals were exploiting him.
My job is to make sure that patients get what they need, that their basic necessities are being met, and not one of his basic necessities were being met. They would take him to the grocery store and get food, and then the children in the home would eat his food. He is a kidney transplant patient and a diabetic, so he has to have certain food, and he's very, very particular about what he eats. He was basically a prisoner in his own home. I promised him that I would get him out of there until however long it would take.
I remember a conversation Geraldine and I had one day that she said, "I found you a place to live. I'm going to check it out tomorrow." When she hung up, I literally cried because I said, "I am going to be free."
I wanted Mr. Mitchell to move into this apartment complex because it's comprised of older people around his age. And Mr. Mitchell moving here will give him a chance to meet people, make new friends, be able to exercise, eat the foods that he wants.
Oh my. Who lives here?
You do.
How do I like it?
This is yours.
Are you serious?
Every bit of it. Yeah. You're home. This is it.
My goodness. Thank you.
Oh, you're welcome.
Thank you. Oh my goodness. And there you go, bed. Don't let me sleep on the floor anymore. Thank you.
Mr. Mitchell is the sweetest man you'd ever want to meet. He just lightens up your day. People say that I've helped him, but he's really helped me. He's not a prisoner any longer. He's able to live here and thrive and be who Mr. Mitchell really is.
He is the most gracious individual. He says all the time, "I have the best social worker and the best nurse in the world. I'm not perfect," but he makes us feel that way.
I am waiting for a new kidney and pancreas transplant, but Dr. Rowe has requested of me to become stronger. And I am now working with Toomey Home Health Physical Therapy. It is much more than a craft of nursing. It is good human beings taking care of good human beings. And long ago when my mom and I went to church, our job as Christians is to take care of one another, protect one another, provide for one another. And Toomey adopts that. believes that and acts upon that.